Hey guys, it's Faith. I'm just leaving work at about 8 a.m. on a Monday, which is kind of nice, but I guess it goes to show you that the coronavirus, COVID-19, is actually really, really serious. So I don't know what will happen, but we got a email from our commissioner asking us to stay home for up until April 10th. So we'll see what happens, and hopefully I don't get sick. Hopefully any of my loved ones and no one else gets sick. But I guess this will be the start of my self-isolation / quarantine video. Alright, I didn't sleep very well last night. I had some nightmares. This is pretty stressful, what's going on, but yeah, I'll keep you all posted. Alright, bye guys. I'm home. Honey, I'm home. Hi. It's day 3 in self-isolation here in Ottawa, Ontario, Canada, due to the coronavirus. And I've been in my jammies all day, so I actually just put on some clothes, and I noticed that the management company where I rent put up some signs about the virus outside, and I'm just gonna go take a look and see what it's telling us to do or suggesting us to do. Alright, so basically they just said that people who have traveled outside of the country are not listening to the self-monitoring initiative, and that they're not allowed to use the laundry room and things like that. And then they just talked about how you don't need parking passes during this time period. Pumpkin and I are just relaxing, and yeah, I'll let you know if anything changes. Alright, bye. It's actually been a full week of quarantine. Full business week, so I've been here at home. I was actually thinking, I'm kind of going a little bit crazy, so I was thinking about going to the store and just going on a walk, but as you can tell, it's supposed to rain and thunder and all of that later today, so I might skip out on that for a little bit. But as of today, on Friday, March 20th, there was, I believe, 870 confirmed cases of the coronavirus. So I'm just here chilling in my self-isolation, trying to have some fun, and yeah, I've been feeling pretty down this week. I'm feeling alright today. As you can see, I did my hair and makeup just to feel a little bit productive. And yeah, that's about it. I'm just on my balcony right now. Not sure yet if I'm gonna leave the house for the day. Yeah, I'll keep you guys posted, and alright, bye guys. It's Sunday, March 22nd today, and I believe it is day 7 of the quarantine. So not much has changed on my part. I'm just on my balcony again. I've been in all week. I'm probably gonna go to the store today and see if there's any chaos or madness going on. I also just need a bit of a walk because I'm going kind of crazy. But yeah, I was listening to the Prime Minister's address this morning, and there is about 1,378 confirmed cases of the coronavirus here in Canada. So that's pretty scary. And I'll let you know if anything changes. So far, everyone I know is healthy and respecting the self-isolation rules. And yeah, so if I get any chaotic, crazy footage, hopefully there's none from the grocery store. Hopefully everybody's all organized. But if I have any of that, I'll show you that now. All right, bye guys. I'm at the store and I actually ran out of my quarantine / self-isolation snacks. So here I'm going to get them and I'll show you what they are. Actually, joke's on me. Apparently the superstore is closed now because it's like 8 p.m. Normally they're open till 11 p.m. but I guess I'm going home. I was gonna buy some wine, but the LCBO is also closed. Onwards and forwards. As you guys can tell, there's a line to get into the LCBO. And it closes in 10 minutes. I don't know if I'm gonna get in. I can't get this right. Damn it. Oh well, we'll see what happens. Alright, so I got in at the LCBO and now I'm waiting to get in line at the superstore. Yay!
Today, we're launching federal advertising campaigns. You'll see faces that you know and trust, people from our cultural sector getting out the recommendations from our healthcare workers. Not having heard this message won't be an excuse. We're reaching everyone. Listening is your duty, and staying home is your way to serve.
On this Sunday night, cracking down to prevent the spread of COVID-19. Nova Scotia's strict measures.
We are dealing with a deadly virus, and this behavior is unacceptable.
What the other provinces are doing and not doing to control the coronavirus. The emergency economic package.
We unveiled an $82 billion plan.
Politicians get set to vote, but is it enough? The shortage of medical equipment and the dangers facing healthcare workers.
Hey guys, welcome back. Mama Dr. Jones, OBGYN, a mom to 4. Today is March 21st, 2020, and I'm updating you on COVID-19 and pregnancy. What we're finding out is a lot of people could be spreading this virus through asymptomatic shedding. That means that you may have the virus and be able to give it to other people, but not have any symptoms. We're learning this from a few studies that suggested it was probably possible, and then we got some information from South Korea where they've done a lot more widespread testing. It's looking like about 30% of their cases have been in people who were relatively young, 20s and 30s, and a lot of those people had no symptoms, but were able to share the virus with other people. What does this mean to us? Please practice social distancing. You guys have been asking about vertical transmission, meaning spread from mom through placenta to baby. In the last video, I said that we don't have any evidence that this is occurring. Since then, you've been sending me a article that was semi-viral on the internet about a baby who was diagnosed at 36 hours of age. Does this change what I said in the last video? I don't think so. If you read the article, they even say in it that they aren't sure if the baby contracted the virus during delivery or soon after. and they don't have any real good reason to think it happened before delivery. They don't have a positive placenta, they don't have a positive amniotic fluid, they don't have positive cord blood. But when you look at that compared to the fact that we have a study that looked at some babies, not a lot, but as many as we could, with moms who had COVID-19 at the time of delivery, and they looked at amniotic fluid, cord blood, and placentas, all of those were negative.
Have you been briefed by the CDC?
I have.
Are there words about a pandemic at this point?
No, we're not at all, and we have it totally under control. It's one person coming in from China, and we have it under control. And now we're working very strongly with China on the coronavirus. That's a new thing that a lot of people are talking about. Hopefully it won't be as bad as some people think it could be. We think we have it very well under control. The virus, they're working hard. Looks like by April, in theory, when it gets a little warmer, it miraculously goes away. I hope that's true. And I think it's going to all work out fine. Rough stuff, I tell you, rough stuff. But I think it's going to work out good. It's a very contagious virus. It's incredible. But it's something that we have tremendous control over.
You said that you were not responsible for the testing shortfall. Very simple question. Does the buck stop with you? And on a scale of 1 to 10, how would you rate your response to this crisis?
I'd rate it a 10. I think we've done a great job. But I've always known this is a pandemic. I felt it was a pandemic long before it was called a pandemic. All you had to do is look at other countries. I think now it's in almost 120 countries all over the world. No, I've always viewed it as very serious. There was no difference yesterday from days before. I feel the tone is similar, but some people said it wasn't.
The epicenter of the COVID-19 pandemic is still in Europe. Italy is the hardest hit country in the world. 793 people died there in the past day alone. That pushes the death toll in Italy past 4,800. Spain now appears to be on a similar trajectory, and there are fears France, Germany, and the United Kingdom may not be far behind.
Italy's armed forces are having to work harder every day, transporting bodies out of the worst affected regions as the rate of death continues to increase. The mayor of one city says the true numbers are even higher, with many untested people dying at home. The lockdowns are now even stricter, with bans on exercise outside. People are only allowed out for emergencies or to get food. In Spain, the crisis is just a few days behind Italy. This conference centre is being set up to treat the rapidly rising number of cases.
The COVID-19 pandemic has reached another alarming milestone. The number of global infections has now surpassed 500,000, and here's another shock. The United States now has the most cases of any country in the world, more than 83,000, which means it has surpassed China and Italy. In Canada, more than 4,000 people have now tested positive, and though social distancing is expected to help in the coming weeks, right now the virus is still spreading fast. In the face of that, frontline workers around the world are running short of protective equipment. In Canada, some hospitals are already rationing masks and warn a severe shortage of things like masks, gloves, and other protective supplies is imminent.
So I just wanted to share some of my thoughts about the coronavirus here with Pumpkin. I think people are now calling it the COVID-19, but basically I've been keeping track of how many cases the world is getting of confirmed people infected, and I've also been keeping track of how many cases Canada is having. So I'm just staying in my bed, I'm staying in the apartment, trying to be a good citizen and all that. I really just hope that everyone takes care and listens to the self-isolation rules. It actually is pretty scary. I've heard some things that, Canada won't be able to flatten the curve for at least a few more weeks, so we should all lay low. We're fortunate today, it's actually a nice, beautiful, sunny day. So yeah, I'm just bringing this video forward to kind of inform some people if you know, you don't want to watch the news all day and things like that. It can definitely cause stress and anxiety. It definitely is for me. So you can skip over that if you'd like, but I just kind of wanted to give a recap, and this will also be kind of like a video diary. Basically, in 20 years from now, if I want to reference this and see what it was like, then I can look at this video. Anyway, if you found this video helpful or informative, definitely give it a thumbs up or subscribe. And yeah, and I guess I'll see you next time. And unfortunately, if this continues to go on, maybe I'll provide another update, because it looks like the numbers are doubling almost every day in Canada. So I'll keep you guys posted. All right, bye guys. Love you.